Cancer. It's one word no one likes to hear, but personalized integrative cancer treatment may be the solution that can bring hope back into the picture. Here with more is Dr. Dean Silver of the Silver Cancer Institute. Good morning, doctor. Great to see you.
Good morning. Thank you for having me.
This is such an important topic that affects every single person, whether they have a loved one that is struck with cancer or they themselves. We hear about personalized genomic testing in the news, but what exactly is it?
Every cancer is different, so no two breast cancers are the same, no two colon cancers are the same. So we do specialized testing to see the genes of the cancer and to see what natural things and what chemotherapy actually works to kill your cancer.
Show me this graph that we're looking right here. What does this explain?
This is a picture of circulating cancer stem cells, which actually tell you which cells are positive and how much cancer you have in a drop of blood. So the testing is very personalized, it's based on the genes, and it's based on your cancer only.
So you're able to take the blood, find out exactly what the cancer is and how you can fight it. What about this next slide? Tell me about this.
This next slide is depicting different chemotherapies. Yes, I use chemotherapies, but I use them at a low dose, and I use what works in the patient. So obviously the ones at the highest bar graph, that's what I use on the patients. So I use what works.
So you were telling me that you use a slight dose of a percentage of that chemotherapy compared to what the traditional treatment is.
We use what's called insulin potentiation therapy, IPT. So what I'm using is a tenth of the dose of the chemo. So I give a little insulin, I lower sugar, and we know cancers like sugar, so I give a little sugar water, I give a baby dose of chemo, and like a smart bomb, it's sucked into the cancer and the cancer is destroyed and the good tissue is saved.
So let's talk about this next slide that we're going to look at. What is this showing you?
This is testing for natural substances. So we test for things like vitamin C and green tea and poly-MVA, so we can actually see what natural substances kill your cancer. So it's not only chemotherapy in low dose, where there's no side effects, it's also other natural substances. The Japanese doctors have submitted their products, the Americans, the Russians, the Europeans, the Germans. So around the world, South Africans, we've all submitted products, and we test it now for patients to see what kills them.
And this is so fascinating. Let's go over again. So what is the insulin potentiation therapy, or IPT?
Okay,
how does that exactly work?
So IPT, we know insulin opens up cancer cells. So we give a little insulin, sugar goes down. So we know cancer cells like sugar. So I give a little sugar water. I use a baby dose of chemo based on the test. So the sugar sucks the chemo into the cancer, and the good cells are not killed.
A lot of this, you were telling me, is such an important part, is a person's immunity. How do you help raise their immunity to fight these cancers?
This is a fascinating, we can have the next slide, please. This is a test of a patient's immunity. So if their immunity is low, and we can now find out which immune function is low, we can give them back to the patient. So eventually, we can't use chemo forever. So we have to raise the patient's own immunity so they can kill their own cancer. And that's what this test is about. So it's about eating good, about thinking good, sleeping good, low-dose chemotherapy, natural substances, raising your immunity. So it's a whole package. It's not one thing that's going to kill you. And the point of this for listeners, you don't have to die from the side effects of chemo. I have patients alive with cancer for 10, 15 years. Do they still have cancer? Yes. Are they fine? Yes. Do they go on cruises? Do they play with their grandchildren? Yes. So it's a quality of life issue.
Tell me about your treatment protocols.
The treatment protocols obviously is based on this test, number one. Now, lifestyle changes, low sugar, those things, of course, and we discuss that with the patient. But that's the test that's going to tell all the answers. So we usually build the patient up for 2 weeks, get their immunity up, get their other factors up, then we give them low-dose chemotherapy. Again, what the patient tests for.
Specialized to them. And this is because you are so one-on-one with your patients, and it has to be specialized to them. Tell me about an offer that you have for our viewers, because I know so many people out there right now want to pick up the phone and call you.
Surely. There's $100 off our initial consult. And
for the first 20 callers.
For the first 20 callers.
So they can come see you. You can answer the questions.
The first consultation is about 2 hours. It's a long time. I would need all your medical records from every doctor you have. I'd need all your PET scans, your CAT scans, your MRIs, and we'll sit and we'll talk, and I'll show you your options, and I'll show you more of this testing on other patients. And then basically, it's the patient's journey, just like it's my journey. It's my journey to help my patients, and it's the patient's journey to get better, and I can give them options. And unfortunately, the way the healthcare paradigm is set up now under Mr. Obama's healthcare plan, there's really no options for people to have.
And you want people to have options. Well, Dr. Silver, thank you so much for coming in. Really fascinating information. If you want to learn more about the Silver Cancer Institute, you can visit their website, silvercancerinstitute.com, or deansilvermd.com, or call the number you see right there on your screen.